Hi everyone, and welcome back to my channel. My name is Carla if you're new here, and I make videos about how I show up for myself in hopes of inspiring you to do the same. Today's video I am going to be talking to the lovely Dr. Sana, and Sana is my aesthetic doctor, would you say? Does that work?
Yeah.
And having aesthetics done or having tweakments or whatever you want to call them is one of the ways that I really like to show up for myself. After extreme weight loss, losing 180 pounds, I had some really severe volume loss, and Sana helped me to regain confidence in my face. And I think there is a lot of stigma, and I think when people think of getting fillers, Botox, any of that kind of tweakment to your face, people assume, like pillow lips and like that you're all like swollen and things like that. And Sana does the opposite of that. In fact, she actually dissolves that a lot of the time. So I'm just going to let Sana introduce herself, because she's going to do that a lot better than I am. And then we're actually going to be answering all of your guys' questions. And my God, did you guys have, on both channels, had so many questions. So I don't think people get the opportunity to ask an actual medical professional. But I'll let Sana introduce herself to see that she's got the receipts to back up her work. So,
absolutely. Well, hello everyone. My name is Dr. Sana Ascari. I'm a dentist. I'm the owner of Sitara Medical Clinic. We're based all over Ireland and now expanding into the UK as well. I've known Carla for over a year now, and it's just been so lovely getting to know you and to follow your journey and be there to help you regain your confidence and to put volume back in the right places. And to lift that face of yours.
Thank you. And she's really has, I'll put a before and after as well here, so you can see how sunken I looked prior to having it done. But Sana, you're a dentist. Yeah. So, a lot of people, when they think about having something done to their face, they would think that they would need to go to, a plastic surgeon. Mm. I've heard as well that dentistry is kind of actually more in line with having aesthetics done. Would you agree with that?
We would refer to a plastic surgeon for things that are out of the scope of non-invasive cosmetic work. So we're not ruling out the surgeons; it's still needed. But for non-invasive, like injectables and stuff, doctors or dentists are the preferred people to go to in Ireland. The nurses as well can do filler here in Ireland, but in the UK they can also carry out like toxins and everything. So doctors, dentists and nurses, are the safe people to go to.
Okay.
To answer your question, dentistry really covers the anatomy of the head and neck, so we'd be a lot more familiar with a lot of the muscles, and so our whole college course is 5 years of focusing on head and neck, whereas obviously in general medicine you would cover other parts as well. So that's probably why people have a preference to go to a dentist.
I think a lot of people worry about doctors or dentists when they go to their regular dentist, and they're like, "Oh, do you want me to pop some Botox in for you?"
I don't think that works really well. I've done that at some point in my life, where you're doing a root canal in the morning and lip filler in the evening. I think it's better to separate those two things. For anyone that's even interested in getting into the field, I think it is better to just put your aesthetics cap on for the day and just do that.
A lot of people were asking, how do you know who to go to and to trust the person that you're going to for any kind of injectable?
I think the first thing, like I said, is their qualifications. Don't be embarrassed to ask someone their credentials, or, don't just take someone's word for it. I think job professions are thrown out, like aesthetician, that's not really anything. That's not a doctor, that's a beautician.
Okay.
And people get fooled. They also get fooled by awards that clinics have won. You probably know yourself, awards are kind of not, there's something you can pay for. You know what I mean?
Or they could be public voted or something.
You can nominate yourself. It's not really a sign that you're a safe place to go to. Definitely look at the work, their before and afters. You'll be able to spot fairly quickly if they have that more natural look about them, or if they go for a more fake look. And that depends on what, some people probably want, and, a really exaggerated result. I personally am into that look. But main thing are their credentials, their reviews. It's great to get referred word of mouth. from a family or friend that's been to a clinic. But like I said, I just have to emphasize, as long as they're a doctor, dentist, or a nurse,
a medical professional. Okay.
Yeah.
And of course, if you are located in any of the places near a Sitara medical clinic, then you would
come to us.
It's just easier just to go to somebody that you know and trust. So, and I found Sana through a word of mouth referral from a dermatology nurse. Hi, Erica. So I knew that if somebody who was working in dermatology trusted Sana, then I would be in safe hands, which was...
You must have been nervous still coming in for the first time.
Yeah, because even still with that, like knowing and seeing Erica, and knowing that what she had done was so natural, and so like you would never have known that she had anything done. I think that's like still to that point you're like, oh, am I going to look? How is this going to alter my face? How am I going to look? And when I actually walked out of the clinic the first time, and my mom was waiting with Brannock around the corner, and I walked in to the Starbucks, and she was like, oh, you look so much better.
Oh my God.
Yeah, she was like, wow.
Well, the very first time you came here, and I do recommend also people do this, is the very first time you came here, you came for a consultation.
That's true.
You came for a chat, and that's also another way to find out fairly quickly, is this person just trying to sell, or is this a tailored treatment plan based on my needs? And that's what we kind of did for you. And then you had like a plan made out for at least 3 to 6 months, I think, and you knew exactly what you were coming in for each time. And I think that's the right way to do it. Very often we just kind of come into a clinic and say, I want filler, but it doesn't even give the person, the doctor, the professional, a chance to plan. You know, so better to go in for a consultation, suss the place out first as well.
And all the consultations with Sitara are free?
They're free of charge, of course.
Yeah, they're free of charge. So if you wanted to come in and book one just to see...
What do I need?
Yeah, what do you need? What would suit me? And how I knew I trusted Sana and my personal like feelings about it were when I wanted something and she said that wouldn't be good for you.
Yeah.
And I think that's knowing that somebody's not trying to just upsell you and just say, yeah, you need this, you know, and also she's very good at saying, no, that's enough. So
experience, you know what the treatment is going to look like before it's even done, and that just comes with experience. So I find confident to tell you, hey, I think you'd benefit from this, or look, I don't think you need this. That part does come from experience.
Yeah, like it's not like I walked in and Sana was like, you need lip filler, you know, like we've never even touched my lips. So, you know, like it's, I think that's something that a lot of people think, but you know, when you have a professional who's advising you, it's not an upsell because you're still under the Hippocratic Oath and, you know, like ethical person. That's not just an upsell in a caravan in the back of your garden. Have like really specific questions. So obviously with a lot of these, Sana won't have seen somebody's face, so they might not be able to suggest like...
I'll give a general answer if I can,
So a lot of questions around the same thing. I'm 67, will be 68 by the time I reach my goal weight. Is that too late for face fillers or under eye stuff? Another lady asked, I'm 50, is that too late?
No, I think that's amazing, especially the lady who's 68 and she's still looking after herself and obviously making health changes as well if she's losing weight. There's no like age limit as such. You won't get the same result that a 20 or a 30-year-old is getting, but I doubt at that age you even want to look 20 or 30. It really does go to show that age is like just a number, because I have some patients in their 70s or 80s and they're active. They go out rowing, they have their, you know, their face looks amazing, they're fit, you know, they're healthy. So if you can, it's never too late to start.
Okay, that's really good. And is it too early? Is there ever too early to start?
Yeah, I definitely think so, for a few reasons. The legal age to start getting filler is 18, but even still, I think I feel more comfortable at 21 plus personally, and that's even for lip filler. My reason for it is I remember what I was like at that age, and I just wasn't happy with how I looked. I wanted to look like someone else, whereas when you come into your 30s, you want to look like the better version of yourself. And that's a much better reason to get cosmetic work done. You mentioned that I dissolve a lot of work. Most of the people that I dissolve, the girls whose lips I dissolve or whatever, they started really young, and some of them didn't even know what they looked like underneath the filler, and I don't think that's right either.
Yeah, I think what you said there, of to enhance and make you feel like, to enhance your comfortable
Yeah.
look that you're happy with, to make you feel even better.
Yeah.
I think that's it. And I think that's the big difference between...
Yeah, we don't want to go feeding people's insecurities and creating a world where like it's impossible to live up to, you know, beauty standards. Like that's not what we want to do.
I'm in my mid-50s, would love to get the areas around my mouth, cheeks done. No idea what that would entail.
It sounds like filler, first of all. Most of the time when you're talking about the mid-face, the first place to start is the cheeks, because you'd be surprised.
The mid-face would be like this.
Yeah, like, you know, even when someone's complaining about their under eye, nasolabial folds, or even the corner of their mouth, it all stems from losing volume in your mid-face and your cheeks.
Okay.
I think we've spoken about this buccal fat pad, which is one of the first areas that you take fat from when you're like kind of suddenly dieting, and it can make you look gaunt, it can make you look kind of less happy, and you kind of end up with shadows on your face that wouldn't have been there before. So it's all about getting the light to reflect in the right part of your face, and what it also does is lift these areas that the lady was talking about.
So like getting the cheek filler then would help to bring this area up a little bit.
Exactly. And it looks more natural to have filler in your cheek than to have loads of filler in the middle part of your face.
Under eye wrinkles, best advice?
Start SPF early, start your toxins early.
So toxins would be Botox?
Yeah, exactly. Just to prevent as much scrunching of the eyes as possible. Best advice would also be, if you need glasses, wear your glasses, sunglasses.
Oh, wow. Okay.
Yeah. And then to treat it, it's harder to treat than other areas. You know, treatments that I find work are skin boosters. They work really well under the eye.
Which is something similar to, like, a lot of people would know the term Profilo. It's a brand.
Similar. It's a different, like there's different brands of Profilo just being one of the brands. So skin booster, it works really well under the eye. It's also quite safe to inject under the eye.
Okay, that's really good to know.
And then PRP as well, where it's a version of skin booster where they take blood from yourself and you use your own growth factors. Those things work really well under the eye.
So you're basically plumping out the under as opposed to filling?
Exactly. Because not all cases need filler. You need filler under your eye if you have a lot of volume loss under there.
Like I did.
But in the cases where you have kind of crappy skin under the eye, it's usually the quality of the skin isn't great. And so these treatments thicken the skin under the eyes.
There's one lady, I don't know if this is something that you can advise, but where can she get treatment for keloids from an ear piercing?
Ooh, that one wouldn't really be my...
I probably start with a doctor and go towards a plastic surgeon, kind of.
I think so, yeah.
Yeah. People were asking, is there a non-surgical way to help with heavy eyelids or hooded eyelids?
So I would say, even before you think about getting surgery for this, to try a toxin. It's injected in a particular way to lift your eyebrows or your eyelids.
So by toxin will be
like
Botox.
Yeah,
is that the only type of toxin, or is Botox like...
So once again, like toxin is the product, there's many different brands. So Botox would be a well-known brand.
Is this like Hoover versus vacuum kind
exactly.
of thing? Yeah,
okay. But yeah, where you'd want it injected is in between your eyebrows and the corner of your eyes. Those two muscles normally make our eyes a little bit heavier. Okay. So if you can inject them with toxin, you'll relax those muscles, so you'll have less heaviness. And some people get quite a good result with this. They get quite a substantial lift with this. I'm also an advocate of, this is completely separate to aesthetics, but some of my patients use these like strips that you...
Do they work?
I've had a few come in and say that it's great, and then I've had a few that say that it didn't do much for them. But
same with everything, like
the ones that I've seen, I think normally if you have like a lot of loose skin here, it works well, because it can be taped back. And just on the side note, like facial tape and stuff is quite big in Hollywood. It's been around for quite a long time. It's only making its way into the real world now. But definitely I'd recommend to try the toxin.
Before going towards the
surgery, because I do remember this one lady, and she had paid her deposit for her surgery. She was going abroad for it. And before that, a few months before that, she'd had anti-wrinkle injections with myself. And she messaged me and she was like, I wish I hadn't paid the deposit for surgery.
No way. Well, at least she didn't pay the whole thing. Quirky neck. Can anything help to tighten it? I'm 52 years young. I love that.
You know, it really depends on the patient. So someone like yourself, someone slim build who maybe lost a lot of weight, but has a bit of loose skin on their neck. Again, toxin works really well for that. But it's very case dependent. So I'd always like look at someone and say, this would look good on you, or, you know, it's not for you. Skin boosters, Profilo, that kind of stuff will also tighten the skin on your neck. And the treatment that we're going to do today, the Sculpt Gel, works really well on the neck as well. It just stimulates collagen. So the more collagen you have, the less kind of stretchy the neck is. There are some people that refer to like turkey neck as kind of double chin, and those treatments wouldn't be fantastic for you know, if it's actual fat that you have under the neck, under your chin.
And then we also did the chin, like we did a little bit of chin filler, which helped with my little bit of double chin.
It does, because if someone has a weak chin, you can see their double chin a lot easier. Whereas if you have a bit of prominence here, the angle between your chin and neck is different, and so it just, as you can kind of vouch for, it hides the under chin or the double chin, which you didn't really have anyway.
Because I have like a pocket of fat. It can
be very
here.
Stubborn.
Yeah. Then it's just like, if to lose this with weight loss, I would have probably been like gaunt everywhere else. Yeah, you know, so it's not worth it.
It's not worth it.
So we just did that tiny bit. Like, it was, how much was in my chin?
Was that half mil?
Yeah.
So like a really soft filler. It wasn't even anything too dramatic.
No, just to like slightly.
I was surprised you noticed the difference, but like you would in yourself, but no one else will say to you, oh my God, did you have your chin done?
No, nobody. Do you do the lip flip?
Yeah, we do. That is just some toxin, some anti-wrinkle injection over the lip. It relaxes the muscle that stretches your lip up when you smile, and can be a good alternative sometimes to lip filler. Okay,
so that's what it is. It literally makes the appearance of the top lip bigger.
Yeah, it perks out the top lip a little bit more.
All right. You asked, is HIFU as good as people says it is? I don't know what that is.
HIFU, yeah, it's kind of like in the range of like laser treatments or high frequency. It's I don't do it myself, but I have sent people over to a laser clinic in my area for it, and they get good results, especially for an area like the neck where we don't have, you know, a whole toolbox of treatments to work from. I think it's worth trying, definitely.
Okay. This one was really interesting, and this is actually one of the ways that I know that Sana is not a charlatan and has like ethics. Been looking at Botox for TMJ, so I'll let you explain what TMJ is to people who don't know, but read it can cause a jowly look on some. Is that true?
Yeah, so what she's probably referring to is excessive like teeth grinding issues, which is causing jaw pain. And usually in these patients, we have like an enlarged masseter muscle, which is a square muscle in the corner of your jaw. Injecting that muscle can slim the face, first of all. But in the wrong patient, it can, slim it so much that you do get a little bit of jowling. It's case dependent, because if your muscle is really prominent, then you could probably do a little bit of toxin in that area. But, if after the consultation we felt like it's not suitable for you, we would let you know in the clinic, or whoever's seeing you should let you know.
Because you suggest that I didn't get it, didn't you? Yeah, because if I did, it could end up, we'd need to put filler.
Exactly.
Here.
So you're putting in filler and then you're reducing volume, so you're kind of not at anything. Yeah. But it's a fantastic treatment for anyone that does suffer with like teeth grinding.
Which I do. Can filler migrate?
Yeah, filler can migrate. Filler has been shown also to last a lot longer than they say it's going to last. Like, when you do ultrasounds and stuff, you can see that filler is sometimes present for years. And if it's injected in the wrong plane or the wrong product is used, you can get migration, usually seen in the lip area because it's such a dynamic area. Thankfully, filler can be reversed as well. So if you did feel like you had migration, I wouldn't sit on it. It's not going to go away by itself, too quickly. I would just get it reversed.
Like if it was to migrate, like would you expect, like have you experienced people who've had filler migrate, or is that based on how it's administered?
I wouldn't say, I would say even the best doctor in the world can inject someone and have migration.
Okay. My skin at my brow bone is starting to sag, so I'm looking for small tweaks I could make, but not sure what's possible.
So that would be another person who is finding that their eyes are getting more hooded with age. What happens is that we lose bone around our orbit, but we don't lose the skin, obviously. So the skin, obviously,
bone.
The bone kind of starts to. If you look at an older skeleton as opposed to a younger skeleton, the younger skeleton has a lot more like a smaller kind of orbital rim, whereas the older skeleton will have like a bigger socket.
Wow.
So because of that, we lose support, and obviously the skin is kind of reducing in collagen, so it's quite normal to experience what this lady's experiencing. But like I said, start with the anti-wrinkle injections and to maybe try the tape.
Okay. Do the injections hurt? It depends.
I don't think anything
side she's doing.
Left side always tends to be a little bit more painful. But I don't think anything that we do would classify as like painful.
No, nothing. I would call it uncomfortable in some.
I would sooner get any of these treatments than a wax. I don't know about you.
Yeah, actually, I think
it's in around the same.
It's in around the same as a waxing. Yeah. Like if you've had I think the last time I was in here, I think we did like something like 40 stabs in my face or something like
Was that like the skin booster, but we were using a needle with it? Or
we were skin booster, we did loads of tox, we did filler, we did my neck.
It was a big appointment.
I was here for a long time.
Yeah.
I looked great.
There's also a benefit of getting everything done. There's pros and cons. Like some people like to get everything done in one session, and then they can really appreciate their face. I'd recommend that to people that know what each treatment is going to look like,
because we at the start we went very gently for me onto we did Botox, and then we did 2 parts filler, and then we increased so that I didn't want to walk out and Vincent be like, who the hell are you?
That's not my wife.
Exactly. So we wanted to make sure it was not, and I think that's.
But once you know what you need, and you just want to kind of maintain it, and you know that you're due all of those treatments, because they're not all going to be due at the same time normally. But in your case, it was. It's great to have it done all at once.
Oh yeah, I was totally fine with it. Yeah. At this point, on my first appointment, because you don't know what to expect, I will say that the Botox injections are is that it? I was like, are you done?
And then you don't see anything for a few days and you're like, did I even get anything done?
What did she do? The skin boosters were no problem. The majority of the fillers have been no problem. I think the under eye on my left side was a little spicy, I'd say. It'd be almost, it's more uncomfortable. It's just
pressure, isn't
it's a pressure, and you're kind of aware of something happening because it's slower. I think that's the kind of it's not like a quick injection, it's like a smoother process, so you're like but it's fine, honestly. If I can do it, I had a massive fear of needles, so
remember that.
I'm and I just got 3 more piercings done as well the other day. So is bruising inevitable?
Is bruising inevitable? We do everything we can to make sure that you don't bruise. We use special needles called cannulas, which are less traumatic. Being aware of the anatomy of everything. We have quite a low bruising rate in the clinic. I would say, I want to even say 1 in 100 people that come in here bruise, which is
I think
really low if you're injecting people for a living. Have you had bruises?
I've had 1 bruise on my neck from the last time we did the Botox, and all of you thought it was a hickey. It was yes, it was.
I would say if you're on, if you're taking anything alcohol will increase your chances of bruising. Certain painkillers like ibuprofen and stuff would increase your chances of bruising. So just be mindful of that before your appointment.
Okay, that makes sense. When you start, do you have to continuously doing it?
No. And that goes the same whether it's toxin or whether it's filler or for any of the treatments. It's quite addictive, so I don't know many people that stop getting it done, or we'd often have brides that really go all in and they get their whole face perfect, and then early days of married life kind of takes over and they forget to come back in. They'll always come back a few years later and they'll be like, okay, it's time to anyone that likes to look after themselves will keep up these treatments, I think. But I think
it's like getting your hair done now, or having your wax or whatever, your eyebrows. It's just how long do treatments last?
So fillers can last kind of a year, 9 months to a year. Anti-wrinkle injections kind of 4 to 6 months.
Can I still give blood if I've had the injections?
I think there's a rule where if it's done by a medical professional, you can.
Okay. Just double check probably with
double check. Yeah, I do think that there's a rule that, if you've gone to somewhere, it's the same with, what's the situation with tattoos? Is it?
And I think it's piercings, I think it's 6 months. But yeah, I should check with the blood
That's
bank.
A good question.
Yeah.
But the last I heard someone tell me was, I go to you because you're a medical practitioner, so I can continue to give blood.
Oh, that's great.
Yeah,
cool.
yeah.
Great, good to know. Does it feel natural, or do you know something has been done? That's a really good question.
I think it feels natural. Like you're not aware of it.
I think for me, the first 2 days after I've had under eye, I can kind of feel it. Like I kind of like.
You wouldn't be so thin there.
Yeah, like you wouldn't be aware of it. Like I wouldn't be like, there's something in my skin. It's more like, it's more that it's filled.
Yeah.
It's actually where
and
it's
I'd be the
supposed to
kind
be.
of person, I can't even sleep with like nail varnish on. I'm so like weird about like having something extra on me. So like I totally get that lady's concern.
Yeah.
The first time I had anti-wrinkle injections, I was so afraid that it would be this like tight feeling. But it's actually the opposite, isn't it?
Oh, are treatments the same for men and women because the skin is supposedly slightly different?
Yeah, that's a really good question. Men with toxins would need a higher dose most of the time. Filler, like men are looking for something different. The most popular filler treatment for men would be the chin and jawline. And it makes such a difference. You know, if you're not, especially if you don't have a beard, like, you know, normally men would kind of grow out their beard to chisel their face out. If you can't grow a beard, chin and jawline filler works really well.
Wow. Can you have it done if you have a beard? Or do you have to
can.
shave the beard?
Yeah, you can, because some people, even with the beard, they'd have quite a smaller, round face, whereas for men, they generally prefer to have more of a square face, so that can all be done. We have different proportions for men and women, so for example, the width of your cheeks should be wider than the width of your jaw for women, but for men, it's kind of 1-to-1, so that creates the square shape. So all of these things are taken into consideration when we're treating the different genders.
So fascinating. God, I love this stuff. Tell me more. Is there anything you should avoid after having any kind of treatment?
Exercise, alcohol, anything that would increase your chances of bruising, like ibuprofen, makeup, you know.
For like 24 hours?
Best to keep it off for the day, anything that will irritate your skin, like retinols, lasers, that kind of stuff. But mostly it's just common sense.
But that's only for 24 hours?
Yeah.
So that's it, like after the
lasers or facials, that kind of stuff you'd want to leave for, a week or so.
And you can't have I can't remember what it's called, but the radio frequency microdermabrasion. No, microneedling.
The RF microneedling.
You can't have that with filler.
It's meant to dissolve your filler.
Yeah, so and it can migrate with that. And actually, I don't know if I told you this, did I? I went to have that done, and the esthetician was like, well, obviously you've no filler. And I was like, my face is full of filler. And she was like, your face cannot be full of filler, you have none. And I was like, no, I have everywhere, my temples, my cheeks, my under eyes, my chin. She was like, that is the most natural filler I've ever seen. So there you go. Good. Yeah. So I was like, there we go. So that was for my skin, not for like the shape of my face or anything. Yeah. And I think that's something as well, like fillers, I think people get confused between what the purpose of filler and what the purpose of Botox is. So maybe you could tell us a little.
So like Botox would be to relax muscles, to reduce kind of dynamic lines. So a dynamic line would be one that we kind of produce when we're expressing, whereas filler would be to restore volume where we've lost volume. A lot of people think fillers are used to fill lines, and I don't really like that practice, because I feel like you can end up with filler in the wrong part of your face then, and ruin the shape of your face. So we stay away from filling lines. We prefer to kind of give your face a better shape, and like you said, skincare still has a really important part to play. Like, it's not gonna Botox and filler isn't the be all and end all if you're not looking after your skin, looking after your health, that kind of stuff. Still, there's
no point in doing all of this if you're not going to do the rest of it as well.
It is still important. So it's great that you go out and get your facials or look into microneedling or whatever. The Botox and filler is kind of the scaffold, but your skin is still important to look after.
That's nice. Yeah. What is it that you offer here in Sitara?
Yeah, so we offer anti-wrinkle injections, we offer filler, we offer like skin treatment, skin booster, Profilo, PRP, Sculptra. We offer threads. They're kind of reducing in popularity now. Yeah, that would be kind of the...
And then
yes.
Sarah?
Emsana?
Emseller,
yeah,
okay.
Fantastic chair that tightens the pelvic floor.
Which I will be getting on very shortly because I am going to be using that bad boy. Yeah. That's for sure. So thank you so much, Sana. That was so wonderful. So I will leave all the details for Sana, and I'll leave her Instagram as well for Sitara Medical if you want to check it out. And just always with whom you're ever, going to, make sure that it's a professional and somebody that you trust and somebody that you like as well. I think that's important. Absolutely. That you get on well with them and that you trust them. If you've made it to the end of the video, please leave the injection emoji in the comments down below. And if you have any more questions, leave them in the comments and maybe we could do another version of this as well in the future. So thank you so much.
Thank you, everyone.
Thanks, Anna.
No worries.